So on the ear, you can find a release for your tight or achy forearms. As massage therapists, yeah, hello, this happens. The ear, the external ear, is supplied in large part by the vagus nerve. It's the parasympathetic controller. It's trying to keep the whole body calm and peaceful and working harmoniously together. So when the vagus gets ramped up and irritated and becomes one of those facilitated nerves, it's like a 2-year-old with a bad temper tantrum, then you've got a whole lot of other things down through the body that can be not happy, that can be dysfunctional and creating a number of different kinds of problems in the body systems. When you learn to do this little thing, you can have something that can help yourself in a lot more ways than just your forearm. And here is a fairly complete picture of my interpretation of the ear. So, what can you do? You're going to use a little stroke again. Well, let me say also that the elbow is mainly behind the ear. So you have to like get back here where your ear attaches to your head, back here. You have to get back there if it's really an elbow issue. The ear itself is mostly wrist up to elbow. Most of the facilitated nerves we treat on the same side of the body as the problem. So, to get the best treatment for things like wrists and hands and knees and ankles, you want to work on the side of the body that hurts, but you really don't want to be using that hand. Decide which one of your forearms you'd like to work on. Okay? You got one forearm that's a little more icky than the other. Position it in some way. You know, hold it next to your body, park it, reach it out. Do something with it that makes it feel just a little on the edge of icky. And then take your other hand and start rubbing the ear on that side. Little short, stretchy rubs. And if you have that other arm, you got to do it on the arm, on the side. If you're positioning your right arm, you got to rub the right ear. Yeah, and if you're positioning your left arm, you're rubbing on your left ear. If it's really tender, if it feels like you're kind of ripping and tearing it, that means that's a lot of facilitated, hyper-irritated nerves in that ear. I see some funny faces. So some people are finding that that ear is pretty tender, and it could use a bit more of that work.
And you've got to crisscross it to do it.
And you should crisscross, because if you're using this hand, then you're engaging those muscles differently, and you want to be treating those muscles. That's why I'm having you hold them in a position that's just a little uncomfortable, because if you have the limb in a position that's a little bit compromised, that's when you're going to get the results. That's what makes my facilitated pathways work different, is that you're engaging the muscles in a way that they find a little bit challenging. Not really painful, but a little challenging. And it's really calming.